Good morning, everybody, and welcome to our question and answer session on vaccinations. And the reason we're having this meeting today is to talk to people who may be hesitant about the vaccine or have some queries and want to be reassured or to find out further information for themselves to make their own decisions. So today we've invited some people from public health, our GP colleagues, and people from Norfolk County Council to answer some questions that you may have on the vaccination. So what I'm going to do is I'm going to invite people to introduce themselves and then we'll have the presentation and take questions. So firstly, on my screen, so apologies if it seems rather random, but I shall do this. Kelly, would you like to introduce yourself?
Certainly. My name is Dr. Kelly Markham. I'm a GP in Norwich and I have worked in the city for, oh gosh, nearly 10 years now. And I haven't really much more to say. I'm happy to answer any questions anyone may have.
Thank you, Kelly. Thank you. And Janine.
Hi, I'm Dr. Janine Smurl. I'm a GP in Norwich too. I'm also a clinical director for Norwich PCN, and with that, we are running the 3 vaccination centres in Norwich that are in GP practices, and also been doing the some of the care home vaccinations and things. So I'll be happy to answer questions.
Thank you, Janine. David.
Good morning. I'm Dr. David Golds. I'm Care Home Clinical Advisor to the CCG.
Thank you, David. Now I want to introduce both public health colleagues here. Louise, can I introduce you first?
Good morning, everybody, and thank you so much for joining us. I'm really pleased you're being able to join us, and we are here just to answer your questions. My name's Dr. Louise Smith. I'm Director of Public Health for Norfolk. So I've been working at the centre of the COVID pandemic over the past year, and I'm really optimistic about the benefit that the vaccine will give us as we try to get life back to normal.
Thank you, Louise. And Susanne.
And I'm Susanne Meredith. I work with Louise. I'm Deputy Director of Public Health at Norfolk County Council, and I've been working on the vaccine programme for public health.
Thank you, Susanne. And I do believe Tim Weller. Tim, are you here?
Hello, Christine. Yes, thanks. And I'm sorry I can't put my camera on at the moment. Something's not working there, but you can see my face on the spot. I'm Head of Integrated Quality for Norfolk County Council and Norfolk and Waveney CCG. So I probably can't answer any detailed questions that the doctors before me can, but if there's anything statistics, I might be able to pick some of those up. Thanks.
Thank you, Tim. Thank you very much. And I think is Cheryl. Are you here, Cheryl Hicks? I can't see.
I am here.
Oh, Cheryl, brilliant. Oh, fantastic.
Quality improvement nurses at Norfolk and Waveney CCG. I'll be in a similar situation to Tim, that I won't necessarily be able to answer such direct questions that may go to GPs, but I will try and help. I am actually redeployed to deliver on the programme once a week. If there's any questions around actually administration and being on the front line, I have got some experience of that. Thank you.
Thank you. And I can't see Kalu at the moment, so unless I'm just going to ask a call out. Is Kalu there? I don't think he is. If he does join, we'll introduce him later, but he is one of our CCG colleagues. Hopefully he'll be able to join soon. So I think we may as well start. Susanne, did you want to do your presentation first?
Thank you. Did you want Louise to give an introduction first, or you have?
Okay. Actually, yes, that probably would be the best thing to do. Louise, sorry. Yes, that would be all right.
I don't have a lot to say. We will crack on. So, as I said in my introduction, I am hugely supportive of the vaccine programme. I believe that the evidence that we have is that it is safe, and it's a really important part of what we need to do to fight COVID. I'm really pleased we have colleagues from the NHS here. I know you're very, very busy getting those vaccines rolled out as well as running normal services. So thank you so much for putting the time aside to join us today. And thank you also everybody for joining us on this call. Social care providers, residents and staff are priority number one for us in rolling out the vaccine programme. You are highest risk in terms of the vulnerability of your service users, and we want to do everything we can to support you to provide the care and the high quality services that we know that you strive every day to do. So we're here to answer questions. If we don't cover everything in the meeting today, follow up by email and we'll do our very best to try and address issues. On that short note, Susanne, I'll hand over to you.
Thank you very much. Rightio, I'm just going to share my screen. Can I check, can people see my screen?
Yes, I can. Yeah.
Fabulous. So the first, so good morning. And I've been asked us to start the ball rolling by talking about a few of the common questions we're currently hearing about recently. I'm not going to go into massive detail because I think the answers that the panel are going to give to specific questions are going to be the things that you'll really want to hear. But the first question we're being asked all the time is the COVID-19 vaccine safe? And to start with, like all medicines, any vaccine approved in the UK has a robust and rigorous testing process. And the standards for the safety and efficacy for the COVID-19 vaccine are the same as for any other vaccine approved in the UK. So they've been through those trials for safety and efficacy. Now, the MHRA, which are the Medicines and Healthcare Products Regulatory Agency, they are the independent regulators. They're independent from any government, and they have confirmed to us that no steps in those safety trials have been missed out. The standards haven't been slipped in any way, and they have approved the COVID-19 vaccine for use in the UK, like they would do for any other vaccine. But in addition to that, since those trials, over 20 million people in the UK have had their first dose. And there is an ongoing monitoring and reporting system in place for any safety issues that arise. And that's the yellow card scheme. So any adverse effects or any things that people are worried about, they report them back through the system. And the MHRA are gathering all that information together, and they're being very vigilant so they can rapidly detect and monitor any emerging safety issues that may occur. And they've reported to us that at the moment, based on all those things that they've had reported back to them, they've encountered no major side effects reported. They're still saying that the vaccine is safe. Now, as is the case with any medicine and any vaccine, there are some side effects reported that are generally mild, and some people don't even have them at all. But the mild side effects that we're hearing are common, are having a sore arm after you've had the vaccination, perhaps having a mild fever or a headache or feeling tired and achy. And they are normally things that people just take a paracetamol and look after themselves for a couple of days and they feel better. But they actually reflect the normal immune response that's triggered by our bodies in response to the vaccine. And that's actually sort of showing that the vaccines are actually working. Now, the second question we're hearing a lot is that some people are worried about how fast the vaccine's been developed. Why has it been developed so quickly compared to other ones? And the concern that something must have been rushed through and something must have been missed in terms of safety. Well, we've had assurances that no steps have been missed out. And so some of the explanations about how this has been done so fast is firstly, the global emergency has really focused minds. It's helped focus priorities. Governments have provided considerable investment across the world. So there were no delays in getting investors to invest in the development of the vaccines. Sometimes for other medicines, there are delays in getting the money to do so, but in this case, there hasn't been delays in that. The vaccines have gone through the normal 3 stages of clinical trials, but instead of being run one after the other that they normally do, they've all been run in parallel. They've been run at the same time, which has speeded up the overall time of the vaccine production, but it didn't speed up the research time. So the same amount of research time has gone into it that normally happens. And people have been quick to volunteer and to take part in the trials. So often it takes a long time for people to be recruited. Because of this emergency, wonderful volunteers have been very quick to volunteer, and they were ready to go once the vaccine was ready to trial. So that again speeded up the development of it. Now, we also have other common questions, and I'm going to start by saying, wherever you get and that you have any questions, please seek reliable sources of information. It's very easy. I've seen some headlines in the last few days about vaccines, and papers make up headlines to sell their papers, and you sometimes have to read into the detail before you actually realise that actually they've made sensational headlines to sell their papers, and they're not actually true, or they've been based on hearsay or anecdotal evidence. I would say wherever you go for your information, please make sure it's reliable. And it could be the NHS, it could be other websites that you know are reliable, or it could be your healthcare professional or your midwife or the person that's given you the vaccine. But social media in general isn't the place I would start to get the information I would make on making a decision whether to get the vaccine or not. We've had a lot of questions about fertility and pregnancy. I know there'll be a lot of questions and answers to the panel. I'm not going to go into detail here, but I would say that Tommy's website has lots of useful information on this, and also the Royal College of Midwives and the Royal College of Gynecology and Obstetricians have come out in support of the vaccine. With regard to meat products, some people are worried that it might contain pork products or other animal-related products. Neither of the vaccines in use here contain pork products or egg products, and they've been confirmed by various faith groups. And the Muslim Council for Britain as website is a very good source to get that information if you're worried. Also, the Vegan Society has come out to support the vaccine. So I will stop there, hand back to Christine, and for the rest of the time we're going to have detailed questions and answers from the panel. Thank you very much. Christine, we can't hear you.
Sorry, I've done the classic. I forgot to unmute myself. So thank you, Susanne. We'll make sure that people have access to that presentation as well. So that's very useful because you've got some very good sources of information on there. I have got some questions already that have come to us. So I'll start off with those questions from the panel, but we're going to have some more as we go on. If people want to put questions in the chat box, please do. And also, as I've explained, if you want to ask a question and you want to ask it directly, you can still do that by raising your hand or making yourself known by waving at us if you put the video on. So either way is absolutely fine. Chat box, hand raised or wave, absolutely fine. So the first question is Susanne commented on. We've had lots of questions about people concerned about fertility, the impact on conceiving and so on. So here are some of the questions that we were sent. I'm planning to have a baby and I'm worried about having the vaccination. Is it safe? Can I go to Janine to start us off with this?
Yes, I've come across this question over and over again because we have been vaccinating so many people within the vaccination centres and also in a care home setting. What I say to people is that vaccine, generally speaking, during research for any drug or vaccine, they don't include pregnant people while they're doing the research. but later on, then they look into the safety, and then they'll do the research, which they're doing. And one of the reasons they'd stated that they didn't want someone to be pregnant or planning to be pregnant for the research, it wasn't any worries about fertility. It was because they knew that there was going to be a course of 2 vaccines. So they wanted to exclude people who were trying to get pregnant within for the next few months. So to start with, there wasn't any concerns whatsoever about the vaccine causing any issues if you do become pregnant once you've been vaccinated. But what I say to people who ask me that question is that if you're planning to get pregnant, you should have a vaccination and protect yourself against having COVID, because what we don't know is how COVID would affect you in pregnancy. We don't know how COVID might affect a developing fetus. We don't know what your immunity is going to be like because when people are pregnant, they tend to sometimes develop gestational diabetes, they'll gain weight, their immunity is different. We don't know how you may respond to COVID. You may develop long COVID. Also, if you became very unwell with COVID during pregnancy and you had to be hospitalized, many of the drugs that they would want to use to treat you haven't been tested in pregnancy. So to me, I would say if you would like to get pregnant, have your vaccination sooner rather than later.
Thank you very much, Janine. Megan, I know that you had some supplementary questions in relation to this from somebody. Did you want to mention those?
Yes, of course. So the first one was being, if the vaccination was had, how long after taking it would it be safe to continue trying to conceive?
I would say that if you have the vaccine, you're just going to be receiving part of a dead virus into yourself, and you're going to be developing immunity to it. I don't per se think that you need to delay, but I would say if you waited 2 to 3 weeks, by then your immune system's already been well, the dead virus is cleared and you're already got some immunity after 2 weeks.
I think that sort of answers the next question, which is, would I have to wait till I had both my injections?
Okay, so I think that the problem may arise is that you may get your first vaccine and then you would become pregnant. During pregnancy, it's not advised to have the vaccine at the moment. Well, you have to have a discussion about your risk benefits. So if your health risks are such that somebody would recommend your second dose, then you would have that. But at the moment, we're not. We're advising people not to have the vaccine while they're pregnant. They're actually researching. I think they've got 4,000 people who are pregnant. Pfizer's actually doing a research study, so hopefully that will be out. But so I think that's but have your first dose. After your first dose, you'll get a fair amount of immunity in any case.
Lovely. And there was a couple more questions on this. The other one was, if I have the vaccine, will it affect my conceiving?
No. No. That's been answered over and over again. It won't affect your conceiving.
Brilliant. And I think the rest are asked and answered. So that's brilliant. Thank you.
Thank you.
Just to add, we do know that unfortunately coronavirus can cross the placenta, and there have been some sad cases where that has happened. So it definitely is worth getting vaccinated if you're thinking of having a baby. We don't think it happens very often, but we know it can do that. So it is really important to get some protection if you at all can.
Thanks, Kelly. Thank you. I'm just going to ask everybody that's here, were there any supplementary questions that you had about fertility, conceiving, anything like that you wanted to ask? Please put your hand up or come off mute and ask the questions. I'll just give you a minute or so just to ask any questions. I just don't want to rush it if people have got something that they want to ask about. we can always come back if people are, you know, wanting to ask further questions. We can always come back to that. But thanks ever so much, Janine and Kelly. Here's another question. All the care home residents have been vaccinated already and are safe. So why do I have to have a vaccine? Really, anybody from the panel? Kelly, yeah.
So the question there presumes that the vaccine has 100% protection, and unfortunately no vaccine can offer that. So although we know that the vaccine does provide a lot of protection, even for elderly people, which is uncommon for vaccinations, you know, this vaccine has worked particularly well and we're really pleased about that, it's not 100% effective. So there's been big studies that have looked into the Scottish care home populations that came out last week, and then this morning Public Health England have announced some research from studies that they've got this week. And we know that the vaccine will prevent hospitalisation and death in elderly people by about 80%, but that's not 100%. Okay, and unfortunately, not everyone will respond well to the vaccine. And we also know that some people couldn't have the vaccine who were in care homes simply because they were either in hospital or they'd recently had coronavirus, or for other logistical reasons, not everyone gets protected. So even though a lot of the residents will have some protection, you cannot guarantee that everyone you'll be looking after will be fully protected, and you could still give them coronavirus and they could still die. So it's really important to think that, yes, it will protect them to a degree, but it's not 100%.
Thank you, Kelly. I don't know whether anybody else from the panel wanted to add to that at all. David? Yeah, David. Oh, you're on mute. You did what I've done.
Yeah, apologies about that. Yeah, I think as Kelly says, now that there's real kind of life information about the effect of the vaccine is becoming available to us. And so just yesterday, Public Health England released that information about benefits to older people, which obviously includes the residents that we care for in care homes. And as Kelly says, although the vaccines have 80% reduction of hospital admissions in the Pfizer vaccine reduces deaths in over 80s by 83%, and in the over 70s reduces symptomatic infection by 60%. I mean, those are great results and show real benefit to residents of the vaccination. But as Kelly says, it's not 100%. But also there's just recently, a week ago, published in The Lancet, which is a leading medical journal, that they've done a study on hospital care workers, in other words, working age adults, healthcare adults, and looking at the effect of vaccination in that group, which is, in a sense, represents, you know, the care workers. And they had a kind of 89% coverage. Interestingly, the coverage was somewhat less with people who had had infection before, thinking that maybe they don't need vaccination, which we can maybe discuss later. A bit less in female care workers, which I guess represents the concerns about pregnancy and fertility that we've discussed. But BMA, the BAME community, the coverage was less in care home workers and in people coming or living in deprived neighborhoods. And those are the exact people who are at risk, more at risk of COVID infection. But in looking at the group that was vaccinated, it was 72% effective, both in reducing symptomatic and asymptomatic infections. So that's fantastic news. Information is emerging now that shows that the vaccine is really effective at cutting infection, both symptomatic infection and asymptomatic infection among care workers. So in a sense, a real positive message to care workers of the benefit of getting vaccinated, protecting themselves, their families, but also the people that they care for.
Thank you, David. That was really helpful and really useful information in terms of the groups as well. So before I progress and before I ask another question, can I just introduce Kalu? Kalu, welcome, because I know that you had to be in another meeting first, but you're very welcome. We've started the session and we've already had a presentation from Public Health and some questions, particularly around fertility. And as you just heard about, residents have already got the vaccine, so why should I have it? So that's where we're up to, Kalu. But would you like to introduce yourself first before we go any further?
Hello, good morning, everyone. My name is Carlo. I work as an integration and partnership manager within the CCG. I cover the South locality, and I'm a BME, and I've had a vaccine, and I'm waiting for my second vaccine, not because I am up to it by age, but because of the nature of the work I do with the vaccine site and also with the CCG primary care. Thank you.
Thanks, Kalu. Thank you. And we'll obviously pick up some questions as we go along, but thank you very much for being here today and at such short notice. Really appreciate that. Right. Well, I think we've already sort of discussed this, but I think it's still worth going back to this because this comes up quite regularly. Usually it takes several years to make a vaccine, and this one took months. How do we know it's safe? Louise and Janine. So can I start with Janine and then go to Louise, if that's okay?
I think that was very nicely covered by the presentation that Susanne gave. So we could really see that there's been nothing actually skipped in developing this vaccine. The vaccine has been because there's been the finances available, the scientists have been available, the people have been available to actually receive the vaccine in their arms as volunteers and recruits. We have been able to turn this around much faster. But now we have a huge volume of real life experience of the safety of this vaccine. We have all these millions and millions of people who've had their vaccine, and we've had with all the reporting we've had through the MHRA or the yellow card. So we have some very rich data now available as well.
Thank you, Janine. And Louise, did you want to sort of supplement that?
I think we've been very lucky in this country, and the introduction of the vaccine has been fast. It's worth remembering that here in the UK, it's been faster than any other country, with the possible exception of a couple like Israel. And the reason that it's been so fast, as well as the information that both Janine and Susanne have already laid out, is that here in the UK, we had research groups that were already working on this issue before we knew what the virus was. So we had research groups, so the Oxford AstraZeneca vaccine, the group there have been so successful because they were working before COVID came out, saying, how could we plan to bring a vaccine onto the market very quickly if a new virus appeared? We always knew that the risk of a flu pandemic was very high, so some preparation work had been done. And the effort across the country has been astounding. I mean, the government put a huge amount of money in upfront to fund the research, to commit to purchasing a vaccine even when we got to the point where one had been developed and was shown to be safe in clinical trials. And that's where we've got to now. We do have a vaccine that works and is safe. I'll pass back to you.
Thank you. Yeah, thank you, Louise. Thank you very much. We've got a few questions that have sort of come up from the previous questions, so I think it's important that we cover those off as well. There's a question again around fertility and pregnancy. So we've got here, so would it be safe to try for a baby although having a vaccine, or would you need to wait 2 to 3 weeks beforehand? Is it wise to have vaccine while on a monthly cycle to prevent any concerns? I'm not entirely certain I've read that correctly, but that's how it's written here. Kelly, did you want to answer that?
Yes, I'll pick that up. So I can understand that when you're trying to have a baby, you don't necessarily know exactly when your cycle's coming and you're a bit worried perhaps, oh, actually, maybe I'm pregnant this cycle and I've been offered to have my vaccination. What we do know is this actually happened in the clinical trials as well. And we are now following up ladies that became pregnant whilst on the clinical trials to have the vaccine, and so far so good. There haven't been any problems, and they are being followed up as probably the closest cohort of those people who were in the vaccine trials that happened last year. What I would say is, if you're at all concerned, then the vaccines are freely available. We're running clinics every week. If you thought, actually, I might be pregnant this cycle and I'm unsure, then if you need to wait for when your period comes and book in your vaccine that week, that's okay. At the most, you're going to be delayed by 2 to 3 weeks. It's much better to kind of feel safe and happy and go and have your vaccine rather than worry about it. And although people may have been trying for babies for a long time, I do understand it's a very emotive issue. I can assure you there is absolutely no evidence that it's going to in any way harm any developing fetus or any chances of you falling pregnant in the future. So if you want to kind of time in your vaccine where you know that you're definitely not pregnant, and then wait for a couple of weeks if you want to make sure you don't fall pregnant that cycle, that would probably be the absolute safest way to do it and won't delay your chances of conceiving in the long term at all. It might just mean you just take it easy for a month. Does that help?
Thank you, Kelly, and whoever asked the question, I hope it does. If you've got any supplementary questions or you want that clarified in any further way, please let us know. But I think that's really answered it very well, Kelly. Thank you. And there's a couple of questions that have come around about the safety of the vaccine when you have a particular condition. So we have a question here, is the vaccine safe for people with allergies? Again, I'm going to look to the doctors on this. Janine or Kelly, would you like to answer that one? Janine?
If you want, I can.
Oh,
can we do that one, Janine?
Yeah. Okay. I mean, the vaccine. Well, there is a tiny chance of having an anaphylaxis reaction, which is a serious allergic reaction to any drug or any vaccine. And for that reason, we are asking those questions, and we are observing people, and we've got anaphylaxis packs on site. They did ask that for the Pfizer vaccine, we are more careful with people who have had anaphylaxis reactions in the past to multiple things. So people who've just got anaphylaxis reactions, say, for example, to penicillin or to peanuts by themselves, they are safe to have the vaccine. The people who have multiple allergic reactions or previous allergic reactions to vaccines, the AstraZeneca vaccine is thought to be less allergenic, and those people are then asked to have the AstraZeneca vaccine. Then again, if anybody's very worried about allergies, it normally happens in the first 15 minutes after the administration of the medicine. So we do observe people very carefully, and everybody is trained on anaphylaxis who's vaccinating.
Thank you, Janine. Did anybody else on the panel want to add to that, or shall we just move on? Because there's another question about safety of the vaccine. So it says here, is the vaccine safe if someone is at high risk of cancer? So Kelly, did you want to take that one?
So basically, I've been asked by the oncologist to get my patients who are in the middle of their cancer treatment vaccinated. They're actually hoping to get people before they get their chemotherapy vaccinated to reduce their chances of having coronavirus whilst having chemotherapy, when of course it can be very serious. So I don't think that we need to be concerned about people at risk of cancer getting the vaccine at all. What we do need to be a little bit careful is that some of the cancer treatments might mean that people don't respond well to the vaccine, so there's no point in getting it, but that would be people mid-treatment. So we are working closely with our oncology colleagues about when we are timing the vaccines of our patients with cancer, but certainly our patients with cancer are in our priority groups to get vaccinated quickly. So I would have no concerns from a safety point of view that it's going to cause any trouble regarding their cancer. I think, in fact, it would protect them.
Thank you. I'm just going to throw it out to the group that's here today. Are there any questions that you've got that you want to come back on those questions that have been asked so far? Here we go. What's the side effect? Can it be 5 to 10 years down the line? Where we go? This is a new question. What's the timeline for side effects? Can it be 5 to 10 years down the line? That Did somebody want to answer that, Kelly? Sorry, somebody's got their sound on. Would you mind muting? Just I'm just going to see who it is and mute them. Apologies about this. Let's just see who we've got.
So Christine, on that question, I think Kalu has his hand up.
Kalu, did you want to? Yes.
I wanted to thank you very much to say something about the safety. The reason why personally I trust the safety of this vaccine is the fact that it is well approved by trusted agencies. Like here in the UK, the MHRA. I mean, these are people who have been working on other medications, and we trusted them that they're going to bring out something that will not harm us. And then you also have the European Medical Agency, and then you have the FDA. I mean, if these three bodies cannot protect us, I wonder anybody that can protect us in the world. So I trust that they have gone through this vaccine, and the public health people have looked at it, our doctors have looked at it, and I see it like even like ordinary paracetamol. If these guys have said this is safe, I go for it. So I am sure that these people have looked at it and known that it is safe, and that is why they allow it to go.
Thank you very much, Kalu. Did anybody else want to come in on that?
I wanted to say is that a vaccination is not new. And the development of this vaccine and this particular vaccination isn't very different to many of the other vaccines that we are using. It's also using it's not using a live virus, so you can't actually catch COVID from it. The immune response that you get to it is similar to any other vaccine that we are having. It's not doing anything differently. But but you've got to compare that to actually getting COVID. So the actual we know that there is a very high incidence of long COVID. We know it can damage your lungs. It can damage your heart, and we also some people during the long COVID period are then developing conditions such as lupus or other autoimmune conditions. It's a nasty virus. So I think if I had to pick my choice of having the COVID infection or the COVID vaccine, I would certainly go for the COVID vaccine. That's for long-term effects.
Thank you, Janine. Thank you very much. Kalu, you have your hand up still. Is that an old hand, or did you want to come back in? Oh, you're on mute, Kalu. You're on mute.
Sorry.
That's okay.
The other thing I wanted to say is, in the earlier question, somebody said whether the vaccine was rushed. It wasn't rushed. I mean, it's built on the mRNA technology, and this technology has been in development. And the medical field has really been learning from so many experiences like SARS, like Ebola, like call it whatever name. And these guys were not sleeping. They've been in the lab working day in, day out. And if something suddenly appears, they will always have something to begin with. So it wasn't that this vaccine was rushed. The thing is that the technology was there, the cooperation was there, the money was there, the political will was there. Everybody wanted to fight this COVID that has locked us in. And I think that is the reason that unity brought all this thing together within a very short time. And people were willing to try it, to do the trial. People were willing to offer their life to save other people. And for me, it's a huge sacrifice for all these people who have done this. And putting all this thing together, for me, that is the reason why it would have been strange if we wait for 10 years before COVID will kill all of us. So I think it was a good work of people coming together and making sure that we fight this thing head on. That was why we were able to develop this vaccine within a year. So for me, it wasn't rushed.
Thank you, Kalu, and I'm so glad I saw that your hand was still up. Thank you. That's really great. There's just one other question here that's come in around, this time it's around breastfeeding. Is there any proof the vaccine is safe during breastfeeding? Kelly?
So basically, there's no evidence that it's not safe. So I know that's not the same as saying it's absolutely safe, but certainly they have been monitoring as the Royal College of Obstetricians, the Society of Midwives. None of them are concerned about breastfeeding women having the COVID vaccination. And that's simply to do with the way the COVID vaccination works. As Janine said, it's either a dead virus or a particle of a dead virus. So there's no reason to, it's not really possible for that to cause any harm to a baby. The only thing I would say is that the breastfeeding mom might feel a bit off colour for a couple of days, but that's the sort of thing that can happen to any of us when we're breastfeeding. We often get a cold or a flu, and we still keep going. So you know, it's just, I wouldn't be at all concerned about breastfeeding and getting this vaccination. It's fine.
Yeah, thank you, Kelly. I'm really pleased there's a question that's come in the chat box, which is about the second vaccination. It says, earlier it was said about having one vaccine, don't you need to have both? I think this is an opportunity. Louise, did you want to come in here about the second vaccination?
Yeah, I'm happy to. The schedule is to have 2 doses of the vaccine. The reason for that is that whilst the first vaccine does give you a good level of immunity, having the second dose bumps that up further. So in an ideal world, we'd be able to get round everybody and you'd have 2 doses of the vaccine. But the context, I think, in which that was said was somebody who's trying to conceive. You would be in a stronger position having had 1 dose of the vaccine than having had none, because it will give you a good level of protection. The second dose would bump that up further if you were also able to have that. Current situation is that if you are pregnant, you would not routinely be offered the vaccine unless you were particularly likely to benefit from the vaccine. So, for example, if you had health problems of your own or a key occupation, in which case your obstetrician or your midwife would discuss the pros and cons with you during pregnancy.
Thank you. That's really helpful, Louise. Thank you. I think we'll go back to the questions that we had that was sent to us at the very beginning. So if I just go back to the top here. I have sickle cell disease. Can I still have the vaccine? I think that is a doctor's question. So Janine, can I come to you on that?
Yeah, in fact, sickle cell disease puts you at in the very vulnerable group, puts you in category 4, and it's very important to have the vaccine. People who have sickle cell disease, their spleens don't function so well, and they are at particularly high risk with COVID. So yes, absolutely, please come forward and have your vaccine as soon as possible. And if you haven't already, let someone know you're category 4 and you should be prioritized.
Thank you. Thanks very much. There is a question here, which I think is a cultural question, and I think we do need to really listen and answer this. It goes back, Lou, to some of your questions around trust, but I think it's also about that cultural trust here as well. So it says, I don't trust the vaccine is safe. given low trust experiences amongst minority ethnic groups with lessons learned from historical examples such as side effects from previous fast-tracked vaccines such as pandemrix during H1N1. So I think this was really about why should we trust this vaccine given the history of using vaccines on particular groups for particular reasons and the side effects that come from that. So I mean, absolutely open to anybody that wants to answer those questions at all. Did anybody want to come in?
Well, I'll just talk about the H1N1. Yes, that was a vaccine that was developed slightly faster than some of the normal flu vaccines, but it wasn't unusual in that it was kind of a standard flu vaccine. It's just that they had to pull it together a little bit quicker than they normally do. It was still tested in the same way. We knew that vaccine had a higher rate of side effects than other flu vaccines, but H1N1 was killing more people from flu than any flu we'd seen in the previous sort of 10 years. And, you know, I remember from personal experience, my husband had that vaccine and was in bed for 3 days with it, which is very unusual for him. He was only 31 at the time, fit and healthy young adult. And then a few weeks later, he went up to ITU to say goodbye to a friend who, a year older than him, who died of it, of H1N1. So, you know, yes, it did give you more side effects as flu vaccines go, but H1N1 killed people. So I think we have to be mindful that not all vaccines in the past have been perfect, and every time we make vaccine we learn from those mistakes. I would say that this vaccine for coronavirus has been particularly well tested, and we have a lot of real life experience with it now. And going back on people wondering, it does feel rushed. I don't think perhaps that we've really fully kind of become aware of just how much the biotech companies really focused on this, like the Pfizer vaccine people, biotech, they just stopped doing everything else. They had their lab running 24 hours a day. They pulled in scientists from all over the world to work on this. The man hours that went into this coronavirus vaccine are the same, if not more, than the person hours, I should say, than any other vaccine we've ever developed. So I think that while I can't speak specifically on previous episodes of distrust in the healthcare system, what I can say now is that we've come a long way. It's 2021 now. And what we're really trying to do is move forward as a whole world community, because we know that this vaccine has to be useful for everyone in the world. Okay?
That's good.
Oh,
Do they know we're here?
I do know you're here. Would you mind very kindly just turning off your microphone? Is that Winnie?
It is. Sorry, we're here now.
Oh, well, welcome, Winnie and guests. We're just answering questions at the moment. So if you want to ask any questions, you're more than welcome to put them in the chat box or raise your hand. But in the meantime, if people wouldn't mind just muting themselves, otherwise we get all this sort of background noise.
Apologies, that was my fault. I thought we were already on mute, but we will be now. Sorry.
Oh, no, it's absolutely fine, and welcome, and you're very welcome. And please do ask questions as we go along. You just pop them in the chat box, or if you want to, just put your hands up, or if failing that, take your microphone off and say, please, can I ask a question? It's absolutely fine, so welcome. Thank you so much, Kelly. That was really, really helpful. We've got another question here that, David, sorry, David.
Well, I think, you know, we have to recognise that there are issues of trust, and I think there is a history of racism actually in the past in healthcare and how things have been done in the past. And also, I think we have to recognise the strength of generational beliefs among some groups and the influence of family elders, for example. So what I would ask perhaps back is, well, what can we do? How can we best all together kind of approach this to support people about coming to a decision about this, in getting the advice and support they they need. Because I think actually there are ways that people can be kind of helped through this or supported through this, but I think we have to respect these concerns and views, and maybe together work out how to go forward. So maybe I would ask people who who are raising these questions, well, what do they feel the best approach is to overcome these these concerns that we really must take seriously?
Thank you. Kalu, were you going to come in? I saw you move there. I didn't know whether you were coming in. Yeah, Kalu.
Yeah, I totally agree with what David said. I mean, trust is a problem in the system. And apart from some of these fears that we were trying to answer, whether it's safe or it's not safe, they're all contributing to the issue of the trust. And the other bit of it is the social media. You have so many groups of anti-vaxxers that are going up here and there. And also, at the early time that nobody really knew what COVID means, what it was, there were a series of comments, that were directed to BMEs, some to developing countries, some of them being that people are going to be dying anyhow on the street. For me, I listened to those conversations, but at some point I stopped listening because I felt like nobody had a clear understanding of what was going to happen, partly because of fear. It wasn't only the BMEs that were afraid, even non-BMEs were also afraid. Everybody in reality were afraid. So I think we also need to recognize this thing happened at a very bad time. We also were struggling with the Black Lives Matter and also so many other racism issues within the system, and people tend to lump them together. For me, I try to untangle them because they're not the same thing. We are talking about health here. We're not talking about racism, and COVID doesn't discriminate. And the data we had at the beginning point of this COVID incident is the fact that so many BMEs were dying. Some people felt that as if there was a system within the existing structure that just shifted the death to COVID, to not BME people, such that they will be the main people that will be dying. And so those complicated conversations were actually things that were making people becoming afraid. So in terms of where we go forward from here, personally, when I heard about this meeting, I said, oh, it's where I can tell somebody that I've had the vaccine. I said, I'm up for it. So we need to get people to start talking about it, to start trying to, help people to understand what this thing is all about. And another major thing is that if we talk about the BMEs, most of the BMEs have trusted line of communication. If it is possible within the community, I'm leading a program of vaccine hesitancy. What we have been trying to do is to locate people who are trusted men or women in the community so that we can talk through them, and also trying to see how we can. I know we have spoken all this thing in English, but there are a lot of people who want it to be explained in their language so that they will be able to understand it, because my mother tongue, my original mother tongue, cannot really be translated in English if you want to tell me the pain of I'm passing through within this COVID. So it will be possible if we use people and use local languages, which is what the CCG is trying to do, and reach out to these people and also use people who have had the experience to say, COVID is killing, but this is a solution. I think working together is also something that I've found very, very useful, just like this kind of meeting that is being organized. It's a journey, but I am sure we will get there.
Thank you, Kalu. Thank you so much. That's spoken with such passion as well. So thank you so much. I just want to go on to some other questions as well now, which are around the vaccine in social settings as well. It says here, I've had the vaccine because I work in a social setting, but with my wife, but my wife does not work in this setting and has not had the vaccine. Are our residents still being protected? Should it not be the whole family getting the vaccine? Now, this is to do with the vaccine rollout and the priority groups for the vaccine. Louise, can I come to you with this? as well, because this is around decision making at governmental level. So I'll bring you in, Louise.
Yeah, very happy to. The ambition is that every adult be vaccinated, and protection for your residents will only be best once the whole community has been vaccinated. We are, very clear that when you get cases in a setting like a home, that reflects the level of cases in the whole community. You're not an island, you're not separate from the rest of the community. So your wife will be called when the group that she is in, which is probably based on her age, are called. And that takes us to, why are we doing this largely based on age? There's a national committee, the Joint Committee on Vaccines and Immunisation, who set or make recommendations to government on what the policy is of who should be eligible for a vaccine. And government has accepted the recommendations they've made. And what they've tried to focus on is starting with the people who are at most risk, so care residents, and therefore care staff linked to those residents, because your residents are the most vulnerable. And then we're working our way down in age, because COVID does have a very strong relationship with age, that older people unfortunately do tend to have more severe illness. That prioritization of groups is not absolutely clean cut. And there are lots of examples of circumstances where people feel that particular groups or occupations should be prioritized more quickly. But the difference that will make is small. It is really important that we keep going and get as many people vaccinated as fast as we possibly can, which is working with having the age cohorts, because the ultimate goal is everybody to be vaccinated, and the difference it will be is a small number of weeks. So hopefully your wife will get vaccinated with her age group.
Thank you, and sorry for the noise in the background. Having the grass cut, so I do apologise if you can hear the mower. Not the best time, but never mind. Anyway, Kalu, you have your hand up.
It's an old hand, please.
Is it an old hand, Kalu? Oh, okay. All right then. Well, we'll go on to the next question, because we've got a question here, which I have also heard asked as well. This is, I've had coronavirus with very bad symptoms. It's been said that if we get it the second time, we can have milder symptoms. So what's the point in having the vaccine if the second time it's guaranteed that we might have no symptoms or milder symptoms? So can I ask one of the panel to answer that? Janine or Kelly, can I come to you? Janine.
Yeah, okay. It is not guaranteed that if you have coronavirus, that the second time round it would be mild. I mean, hopefully there will be some level of immunity but how long is this immunity going to last? People have also been, it has actually been categorically shown that vaccination gives you better immunity than getting the coronavirus itself. Coronavirus is a very clever virus that it actually suppresses your own immune response in killing the virus, and then to such an extent that you then have this huge response in the second week, which actually damages your own organs to try and kill the virus. It's a very peculiar virus, yeah. So having it's just like saying if you've had flu once, you're never going to get it again. You will, because the flu virus keeps changing, your immunity reduces, and you could get flu badly again. And that's why with the flu vaccine, we do vaccinate people who've had flu in the past, and we do vaccinate people on an annual basis.
Thank you very much. And I know Louise has now had to leave the meeting, Louise from Public Health, but thank you, Louise, for attending. There is another question here, which I think is one that I have, we've been discussing quite a bit recently. So this is, will having the vaccine be made compulsory to healthcare workers? Is it have the vaccine or lose your job? And then the subsequent question is, as a care home setting, how do we stand if staff refuse to take the vaccine? So there's questions now about, should care staff, should it be made compulsory to have the vaccine? I think this sort of comes into some of the fears about the vaccine, and maybe people feeling they are being pushed into a corner, but we want to obviously look at the reasons behind having the vaccine and protecting people. So I think Kalu, that's right, isn't it? It's about acknowledging that people have fears and concerns about the vaccine, but also that there are real concerns about protecting people as well. So if you're an employer as well, you want to protect your residents and the people that you are visiting. So it is you know, one of these very it's like a conundrum, really, isn't it? I don't know, Tim, are you on the call? Tim Weller, are you still able to join us on the call? Because this is really a legal question, a HR question here about the ability to write in a contract that you must have the vaccine. So are you able to answer that at all, Tim? Are you there?
I can cover it in really general terms, Christine. So, as people may be aware, for colleagues that work in the NHS on the front line, whether they're working in acute settings like hospitals or whether they're general practitioners, there's a requirement in their general contracts that they have a immunisation for hepatitis B, for example. So that protects them and the people that they're working with, their patients, in respect of that quite harmful virus. So I suppose there's an argument legally that care providers, in due course, once consulting with unions and others, could make a case for saying that to protect the people that they look after, there's a case for introducing that into care workers' contracts as well. So it's an early stage of conversation, although I happen to know that there are care providers who have taken that decision to change contracts in respect of new starters. So it won't apply to people who are already working in care, that are already contracted in care homes, because their own contracts will cover them for that, and those contracts won't make reference to specific specific health requirements in relation to having received the vaccine, for example. But, you know, moving forward, in order to protect the workforce and in order to protect the people that, you know, care homes derive their business from, there will be an interest in them thinking about how to do that in a way that keeps people safe, and that might be something they're considering. We know that some have already done it, and that's going to make it, I guess, if that becomes widespread, I suppose that's going to make it an issue for people who haven't had the vaccine, potentially to apply for jobs in a sector where it may become mandatory just by the contract, not by law. So law probably won't make it. It won't become part of law, probably, that people have to have it. That's still discretionary and down to individuals to take up the offer, and that's what this meeting's really about. To try to encourage people and inform them about what's available, what the risks are, how they can make a calculated and reasoned decision about whether to take it or not. But yeah, arguably, it could be the case that it could become introduced into contracts.
Thank you, Tim. And it is a sort of hot topic at the moment, and particularly within HR as well. So, but the reason for the meeting really is to reassure people, to give them information, to provide the best data that's out there, to go through some of the concerns that people have had, and hopefully help people to come to their own decisions based on that information. There is a few more questions here, which are, you know, really good ones here. Will we have to have yearly boosters for COVID vaccinations, just like we do with the flu jab? So over to you guys. Kelly, did you want to come in here?
Yeah, I'll come in on that. I hope you can hear me. Basically, probably, but it might not be yearly. We just don't know enough about the virus yet and how good our vaccines are going to work on all the new variants that are coming through. Coronavirus does mutate relatively quickly for the type of virus that it is. And we all know about the different variants because we hear about them on the news all the time, just like the current hunt there is for that per person who's the Brazilian variant and who half the country's looking for. But we don't know how often it's going to be. I think probably they'll err on the side of caution to begin with, so we may well be vaccinated every year, but then it may be that that can be spaced out as we know more. Certainly all of the big vaccine companies at the moment are looking at modifying their vaccines slightly so that they will cover new variants and give us better protection as time goes on. But the answer really to the question is we're just not entirely sure yet. However, the same level of testing and safety and all of those things that have went into the first lot will continue to be used in development of any further vaccines.
Thank you. Thank you. Janine, did you want to add anything to that?
I think it's just basically to say that the research is carrying on big and strong. There's so many people being followed up, who've had the Pfizer vaccine, the AstraZeneca vaccine, the mixture of trying to work out what the best, whether it's best to wait 3 months, 6 months, however long. But it will be science driven for sure, and I'm very confident of that. I think coronavirus is going to be with us for a while. And so it is likely that we will need to continue to be vaccinated. I'm looking forward to them developing vaccines for children as well, because this group, I'm concerned that at the moment the younger population and the children aren't going to be vaccinated, so the virus will definitely not go away. It will continue within our communities for a bit longer.
Thanks, Janine. Yes, that's a really good point, isn't it? Children and the next phase really of the development of the vaccine. Yeah. I think you've answered this one, but I'll just say it anyway again. If I'm going to get the vaccine, how long the immunity against corona is going to last? So that sort of immunity period. I think you did sort of touch on that anyway, Kelly, but did you just want some sort of expand on that?
Well, basically, the answer to that is we're not entirely sure yet. So we are still following up the people that originally got their vaccines in the phase 2 and 3 trials mid last year. And it's unclear as to when the immunity actually drops yet. So we can't answer that question. We know it probably lasts for at least 6 months. We hope it lasts for 12, but we just don't know the answer yet. And that's going to be something that you'll probably hear on the news across the summer and autumn.
Yeah. Okay. We have got it's more like a statement here. So I'm going to read it anyway. And this is, this is from somebody working in a care setting. It says, it's so difficult to encourage staff to have the vaccine in a care setting. So when residents and 99% of staff are vaccinated, staff are worried that working with other staff who are not vaccinated. So there is a real concern about people that aren't being vaccinated and the impact that's going to have on their workforce. And I've certainly heard managers say around the families as well that they are concerned about staff that aren't vaccinated and whether or not they should be visiting their relatives as a result. So there is a real concern out there for managers and staff working in settings about people that aren't taking up the vaccine. I think I need to state that because that is being said. I don't know whether anybody wants to say anything about that. Yeah. Janine.
I want to say something. I think coronavirus is infectious before you become ill, and you can be infectious and not be ill at all. Unlike many other things, I mean, if you develop diarrhea, you won't go to work. You won't go to work for 2 more days, and then you can keep everybody safe. If you get other illnesses that involve having a rash or chicken pox or all sorts of things. You're able to be sensible and keep people safe. But with COVID-19 in particular, as we're not vaccinating children, there is a very high risk of people who coming into work and bringing in coronavirus with them, especially people who are young, who are going to be more in contact with children and young families. And I think it's a real and genuine concern, which I can understand.
Thanks. Thank you, Janine. Thank you. So I know we can't answer that question, but all we can do is encourage people to listen to the facts and make decisions based on the whole workforce as well. Sunita, what vaccine for people phobia is there likely to be? A nasal vaccine. This has arisen as well in the past, where particularly people with learning disabilities actually, but also, you know, some people in the general public have had needle and do have needle phobias. And we have talked about this before, about a nasal spray. David, did you want to come in there?
No. That was related to the previous question.
Oh, I beg your pardon, David. Yeah.
It is an issue where perhaps, you know, care homes require some support with. So how does one support and help the number of staff who, you know, still are unsure, are hesitant about the vaccine? So what I would ask care home managers or care home staff is, again, what sort of input support would help to help those staff? We're thinking about perhaps a series of videos that from trusted sources that could give people advice in a more kind of informal setting. Also, perhaps possibly a panel of individuals, a bit like this group here, who could maybe speak to people individually to help reassure them and go through issues. It's just a question that one, you know, as Janine says, it's important to try and resolve this if we can. And it's so the question really to care homes is, what can we do to help you with this? And rather like when I was talking about the question of kind of trust, it would be really helpful to get feedback from the care homes about the kind of support that might make a difference. So perhaps a plea to have a two-way conversation about this, not just us telling you, but you telling us what we can do to support you and your staff.
Thanks, David. Thanks very much. Thank you. We've had a question here which goes back, I think, to long-term effects versus having coronavirus, really. But why should workers be forced to have the vaccine when no one knows the side effects it may have in the future? David.
Hello. No, you haven't answered the question. The previous one that I interrupted was about phobia. And I don't know.
Yes. Sorry.
Yeah. Kelly would probably have come across people who have been frightened about the vaccine, and also the possibility of a nasal vaccine, because something like flu in children, I think, has been developed. So that's a possibility. But I just wondered about how practically one can support people who are very nervous about having a vaccine.
Yeah. Kelly.
Well, I have to be honest, the way, and I don't know how it's been done across the whole county, but our clinics in Norwich, you know, that you're in an individual room, you're with two healthcare workers when people are having the vaccine. So we've managed to distract people a bit because there's two of us, because somebody's working the computer and someone's doing the vaccine. So I think that healthcare workers, we're all very aware that some people really struggle with needles, and we do our very best to, you know, if someone says to me I'm a bit nervous about needles, then I make sure they don't see it, you know, and there's plenty of distraction techniques done. This is not something that we deal with infrequently in our jobs, having to look after people who don't like needles. You know, there is the facility if someone needs to lie down or feels unwell, you know, that's why we're having our clinics in these big healthcare settings, is that we've got plenty of support staff who can support people. The other thing I'd say is that for people with additional needs and learning disabilities, we are now starting to set up clinics which are running a much quieter environment to try and support those people as well, in case, you know, there's lots of people here with people in their families who they might be worried about having the vaccination. And then if you approach your local GP, they should be able to tell you where we're running specific clinics for people who might have problems. I don't know if Janine has any more to say about that, but you know, we do understand, and we'll always do our best to be kind, because that at the end of the day is part of my job. So
yeah, I mean, we have several people who don't like needles in every clinic, yeah, it is a bit making people feel at ease, acknowledging that fear, not rushing things, and being gentle. And quite honestly, almost everyone who has the jab says, "Oh, I didn't feel that. Have I actually had it?" And we joked. I think David was vaccinating with me the other day that we've definitely mastered the pain-free no bleed technique. Yeah. So no, but it's nothing like having a blood test. It's quite a thin needle, and it's fairly quick. And obviously we've been vaccinating thousands of people. It's quite slick. But I think people actually possibly confuse that with having a blood test, because it is more painful having a blood test than having a vaccine. But to do with people with learning disability, and there's a clinic at the James Paget Hospital at the moment, specially set up. But we will definitely. If it's easier to have it at home, at a home visit, or going to a day centre to give the vaccine, wherever people feel safest to have the vaccine.
Thank you. Thank you. There's a couple of questions in here which all relate to staff taking up the vaccine and about safety for the staff. So it says here, you talk about protecting the residents of care homes with the vaccine, but how are healthcare workers protected when future side effects are unknown? And I think there was another one. Well, it was similar to that. Why should workers be forced to have the vaccine when no one knows the side effects it may have in the future? So, Kelly, did you want to take both of those?
I just want to say that we're talking about knowns and unknowns, and known unknowns and unknown unknowns here. So it is complicated, you know, as I think, you know, the Secretaries of Defence for America have pointed out before when dealing with terrorist threats. But what we do know very clearly is that COVID can cause a long COVID syndrome, and that is devastating for a lot of people so far in the country. It causes all sorts of problems. It causes problems with energy levels, with your neurological system. So people are having problems with how their nerves function. It's not just heart and lungs and kidneys, it's everything. It can be a systemic disease, which is, you know, struck down otherwise healthy, fit young people to a point now where they can no longer do their normal activities. And we know that happens with COVID, okay? It doesn't happen to everyone. Some people just have a mild illness or have an asymptomatic illness with COVID and they're fine, but not everyone is. And we have no way of picking out who's going to be lucky and who's going to be unlucky. And we also have a very sad number of the population in younger age groups who have died with this disease as well. So we know with COVID what it could do if you catch it. Now, we may not know if there's any side effects to the COVID vaccine 10 years down the line. And I cannot put my hand to my heart and say, you know, we can be 110% sure that it's absolutely not going to give any side effects 10 years down the line. But I'd be certainly happy to say that I'm 99.99999% happy that it won't, because it's not a common thing to happen with vaccines. You know, we've been developing these now for a very long time, and the vaccines we're using now are so much more sophisticated than the ones we were even using 15 years ago. So I would be happy for both. I've had the vaccine, and so is my husband. I'd be happy for my children to have the vaccine. I'm happy for all my family to have the vaccine, because I think the chances of the vaccine doing them harm are minimal compared to the chances that COVID would do them harm. And sometimes we just have to be mindful of, well, what's the thing that we know is going to do you harm, rather than worry about an unknown thing in the future. And that's the way I look at it, and that helps me think about these things in that way. Coming back to the issue of trust, you know, I can't I can only speak from, you know, the background I come from, but I do know that there's been problems with vaccines in the past, and that's why we're so much more careful now when we test them and when we go through all the side effects of them. So I do think now that we are that much further ahead than we used to be with vaccine development, and then it is worth considering that as well.
Oh, thank you, Kelly. Thank you very much. I'm just going to pick up a couple more questions that have been sort of given to me just now, and I am very conscious that the time is 11:26, so I'll just take these final two questions. Those that were sent to us that we haven't answered, what we will do is we'll put some answers together following this session. So I think one that has come up here as well is around having choice of which vaccine we receive. Do you have a choice of which vaccine you receive? So could someone pick this up? David, did you want to answer this, or one of the no? Janine, go. Yes. Oh, sorry, Kalu.
Yeah. In terms of choice, so far we in the primary care, I mean, the other time I was involved in the vaccination, even at the point where the vaccine will come, you don't know. You don't know which one that is going to be delivered. So it's only when we start that you will understand that, oh, maybe it's Pfizer or maybe it's AstraZeneca. So I don't think, maybe with time, people may begin to make a choice as per which one they give. But for every location, vaccination location, they don't give two. They only either give AstraZeneca or they are giving Pfizer. They don't give both in such a way that you come in, you say, can I have that one? No, I have that one. It's not working like that yet. That's my little explanation.
Yeah, and Kalu, I think as well there are exceptions to that. If, for example, you have allergic reactions, you may well be you may have a choice then, or you may be given the choice then, but that would be a medical decision.
Exactly.
As a result of that consultation. And also for children 16 to 18, they will have a specific vaccine, which is the Pfizer vaccine. But apart from that, there isn't a need for a choice really, because we don't know which vaccine we're going to get. I think that's the answer, isn't it? So yeah.
Someone said, "What's the best vaccine?" I think it's the one that's in your arm. They're both they're both very, very good vaccines. But the thing to say is that the Pfizer vaccine is very difficult to move around. So the Pfizer vaccine is only available at those certain centres or at the hospital. It's very, very difficult to take the Pfizer vaccine into a care home setting. And also we're hoping that some of the AstraZeneca vaccines will be available at GP settings. The AstraZeneca vaccine can be moved and then be put in your GP practice's vaccine fridge, but Pfizer can't. The Pfizer vaccine, once it's defrosted, it has to be used within a certain number of time, and itself can't be moved around. We were told best not to walk down the corridor in someone's room with it. Even it was like it's quite unstable. So that's some of the choice boils down to where you're having the vaccine.
Thank you very much. Well, I'm very conscious that the time has come to an end. If anybody has any further questions and you want to ask questions following this, please email us and we'll keep looking at them and try and get them answered and out to you, so that can go alongside this presentation as well, or this webinar. So thank you very, very much for attending today and for listening and for asking questions.